So let me quickly introduce Kara. Kara Coleman is a lawyer and program manager at Family Voices National. She's also an instructor of pediatrics at VCU School of Medicine Regional Campus. And she's the mom of 4, one of whom, Justice Hope, was a child with medical complexity who unfortunately passed away 3 years ago. We're so grateful to have Kara with us. Kara, I'm going to turn it over to you to get us started.
All right, thanks. So happy to see some of you, all of you today. I can't always get my gallery place working so I can see all the faces while I'm staring at my screen. Next slide, please. So the fancy and evidence base of information that I bring today is drawing from my own lived experience. Although Justice is no longer living with us, I think daily about what it would be like to have her alive right now during the pandemic and shelter in place, and try to filter that through and how I help and support families around the country. But my evidence base is my network of amazing family-to-family health information centers, which are in all 50 states, the District of Columbia, 5 territories, and 3 tribal nations. And then also my network and family of the CMC CoIIN. We know each other well. So I'm drawing from weekly, we're having state affiliate calls with our family-to-family health information centers and state affiliates. And then also I spent a little time talking to some of our families in the CoIIN and outside the CoIIN this week, just following up on home care supports. Next slide, please. So what do we mean by home care supports? We were just talking in the faculty breakout room before, like, it's so hard to talk about home health care, as Dr. Lael did last week, without talking about school and supplies and all kinds of things, and how everything is really connected. And when Meg asked me to do this, I was like, oh, how do I talk about this? What? And she reminded me that I know. Because I've lived it and I know from a lot of families. So really the questions around home care supports is what and where is a home? Who defines home? Just as who defines family? Does it include the community, the school, the church, fields, gyms, the bleachers at games? What is it? Who is it? And what is care? What is support? What is supportive? And who answers and defines this? The pictures that are throughout are of my family. And I like to use pictures to illustrate things and guide conversations. And at this right here, I put a picture of Justice inpatient, because while we were very close with a lot of providers and inpatient staff, it is not where we wanted to be. So we were very sure, and a lot of our families are very sure, that home is not inpatient. Home is outside the hospital and outside those walls there. And so it's getting to different times. You'll see up at the top there, those are the little siblings providing care, quote unquote, that sometimes is pinching and sometimes is helpful. Next slide, please. So I submit just a little bit further that really home care supports, and what I'm gonna share a bit with you about today, is everything that a child with medical complexity and their family may need, want, dream of, deserve, demand, require, any other word you can think of, outside the 4 walls of that consult room, that inpatient room, the classroom, the therapy room, outside the room, right? And how you get outside that room is a home care support. Transportation, mobility, accessibility. It's not just the supplies, it's not just having home healthcare provider, it's the ingredients of life. And so that's why you have the Coleman Chaos chefs here on the right, the little chefs that are cooking up life. And what type of life you cook up and put together really depends on each family. And I think one of the things that I'm so proud of in the work that we've all done together as a Children with Medical Complexity CoIIN is we've really pushed the conversation forward about what is quality of life for children with medical complexity and what is family well-being. And that's an evolving question. And again, what each family defines in partnership with their providers and their care team together, how it all works. But it's really what is threaded throughout what I talk about today, but in general, how you cook up your ingredients for life are defined by balancing and measuring what is quality of life for these kids and for our families. And it all circles back to family well-being. Next slide, please. So you guys have seen this before in the pop-up webinar. Hopefully most of you attended that pop-up webinar where Debbie Harris and I talked, and Debbie did that really great organized chaos care map where she looked just at and mapped at home health care. This is Kristen Lynn's care map on the left, laying out all the details that go into ensuring the health of her little guy and family, but also the quality of life and the family well-being. And then on the right is my non-artistic depiction of, just trying to show the starkness in the separation that shelter in place has caused for so many families and for providers, for all of us alike, and feeling that gap, and then trying to really come up with creative, curly Q, dotted line, whatever it is, however we can connect for the health, for the well-being, and for the quality of life for kids. Next slide, please. So I thought I would order this. I'm going to share a few stories of experiences, like challenges, and then creative solutions that families have come up with during COVID-19. And then also at the end, I'll do a summary sort of what everyone's thinking and feeling. But I thought I would order the way that I talk about it in terms of, first, what is a child with medical complexity thinking about? What are their most important ingredients of life right now? And I was thinking about it in terms of what I'll call P-Day or Pandemic Day. I think everybody in every state or city, depending on where you are, had a different day. For us here in Virginia, it was March 13th. It was like D-Day, P-Day. Kids thought they were waking up to go to school the next day, and they weren't. And what does that mean for a child with medical complexity? And it's true for kids who are verbal and nonverbal, who, are ambulatory or not. It doesn't matter. A kid is a kid, and the bottom fell out for all kids and for all adults on that day. But for our kids with medical complexity who need technology, eye gazing, standers, different seating options, different communication devices, that kind of D-Day where, sorry, you're not coming back into the school building, perhaps until next year, or until you drive by at the end of the year and pick up a bag of stuff from your cubby. That can be really problematic in terms of a technology communication device type thing, where you're stuck at home without an eye gaze communication board, right? Or without a stander, without other seating options. How do you engage in life then? What do you do? How would you carry out distance learning if the learning is supposed to be using the eye gaze, but that's at school and everybody's, it's just a web of where are the equipments and the supplies that help our kids communicate. And a lot of kids have been kind of caught in those situations. I talked with one mom who was saying, my son had his eye gaze at home, except the stand that made it mobile and functional to be able to engage with a Zoom call and the eye gaze and do therapies and do other stuff was actually at school, and they would not let us get it. So it's just sitting there. The same with a lot of standers. Some families have standers at home, some families don't. Some families don't have room for standers. Some families don't have the 2 or 3 people, available at a time to put a child into stander. And all those, I said it's not about supplies and equipment, but those are the real types of ingredients that a child with medical complexity needs to be a kid, to go to school, to have fun, to, be on the driveway playing basketball. And not all families have those things at home to help, but a lot of families have come up with really creative and great ways. It's the ways that all of us have. I know Debbie Harris talked to us about, her respite is that Zoom book club and happy hour. And that's been true for a lot of our kids with medical complexity. FaceTime of any kind, Facebook Messenger, it's different. A lot of our kids are rejecting distance learning and that kind of forced screen time, but it's different to connect with your peers socially. And that has been really critical. There's been really great virtual bingo, drum circles, virtual youth groups and interactive groups, virtual dances. My daughter, Keziah, is involved with buddies at her school, and they had a formal Friday meeting, but then some of the kids got together and created a little dance party on the side and stuff like that. So you know, also Dr. Lael talked last time about quarantines and building a village, and a lot of families, when I was talking about how are you surviving with home care supports and helping kids be kids and families be families, is that sort of same notion of having a circle of safe friends. And the weather is helping that, where people can get out a little more and maybe socially safe distance and see faces and hear and interact with people and stuff. And one other example I wanted to give is how, you know, why do I have on here advocacy for kids with medical complexity? You know, we talk, oh boy, that's my timer for 10 minutes, and I was going to keep my lecture short, so I'm already in trouble. All right, keep moving. Sorry. But the advocacy that, you know, is really important for our kids is learning to be self-advocates and speaking up for themselves. And one of our colleagues at Family Voices, her daughter has been able to speak up at a protest march recently about being a Black girl with autism, intellectual disability, and health issues and all that stuff, and all the things that she has faced. And it was a very orchestrated, you know, mask on, everybody apart and all that, but just still having that ability to interact and, you know, speak up for herself and develop herself as a young lady. Next slide, please. Okay, so then the next way that I organize it is, so how are we thinking about, you know, what are the challenges for home care supports for families, keeping that whole family unit going? You know, families really talk a lot. It's from the beginning of the pandemic and all the way through, it sort of ebbed and flowed, the stress level and what is causing the stress and how do we be a family. The messaging I really got in the last few weeks from everyone is that there's a lot more self-care that's now going on, and that families, it's probably a really great learning of it, that families are learning to put their oxygen mask on first. And they're doing the best they can with what they've got at home. You know, even if you backtrack to not having an eye gazer, yet you're getting all this distance learning instruction on how to do PT and OT with, you know, an eye gazer, but you don't have it, then you're just like, look, we're not going to do this right now. We're going to do what we can as a family. We're going to, how we function and read a book together as a family, we're going to do so that everybody can participate and get something out of it. Another thing that families talked a lot about is that, you know, a lot of the creative solutioning that has happened or that needs to happen with home care supports right now when there's shelter in place, you know, there has been relaxing of regulations and supports for, you know, through Medicaid to help families, but a lot of their solutions they come up with cost money out of pocket. Some are looking for tutors because they just can't get distance learning or what they need from school, and that costs money out of pocket. And that can be really problematic when we get to the next section, where there's a lot of families that are struggling with housing, with work, either having to step away from work or, you know, being furloughed or whatever is going on, and not having food. You know, for a lot of kids, having that school connection and school breakfast and lunch was really critical. One mom was sharing too, I hadn't heard this, I think though, now I've looked into it, is in several states, that her son with medical complexity qualified needs-based for school lunch. And even though he wasn't going to pick up the school lunch because he's using, you know, G-tube and medical food, they still got an EBT card that they could use electronically. And that really helped the family out in general, because one of the parents had lost a job and so they were short. So that school connection there for food has been really critical, and schools have really stepped up on that. You know, I think hopefully you guys saw in the last newsletter that Vera Spanks, our beloved Vera Spanks from Team Alabama, after our last pop-up webinar with the care maps, went back and really did some care mapping on her own, and talked about what I've heard from a lot of families, that a lot of things are falling by the wayside, but one way in which they're connecting more or have it at different points throughout these last 3 months is in finding advocacy, information, resources to help them figure out how to navigate, to know what's going on, to be able to know, you know, what is the regulation that's changed, and how do I advocate and talk with other people about it. Okay, next slide, please. And then this slide, I'm just, having us go through and talk and think about, we talked a lot in the last session with Dr. Lael about, how you're deciding whether or not to have home health care come into the home. And that sort of flow chart of decision making is really important, has been a theme throughout the weeks for families of how they're navigating it, and continues to be so, particularly as we begin to talk about reopening. And a lot of families talked about that, it is a fear for their own child and their child's health and safety, but it's also really a fear for their own health and safety and what happens if they get sick. And there's a lot of families living multi-generationally, and so who you're bringing in and out is really important. And it's really important to be able to support and have the family be a family that if you have help caring for the child at home, but for other families, you can't have it's too many people in the house and too many other concerns. And yes, it creates much more chaos in the home and a lot on the primary caregiver, but they've got to figure out how to navigate what they need to. There's a lot of supply concerns initially for families of getting basic, medical food and other supplies. A lot of that stuff has been worked out. And I will say that a lot of families said that it was worked out through relationships, and kind of going back to the other slide, the importance of advocacy and connecting with other, community-based leaders or family leaders, and relationships with Medicaid. A lot of the big concern of companies calling to say, hey, we're taking back that backup vent equipment, which is terrifying, got resolved by, family leaders and providers and people coming together and communicating with Medicaid, and Medicaid really going to bat for families, which is really great. The supply concern too for a lot of families, and helping them decide whether or not they're going out into the community and how much, or if they're allowing people in, was making sure that there was enough PPE. And there's been increased access a little bit over the last few weeks, so that's helping families a little bit. The last kind of story here I wanted to talk about a little bit before we go to the summary slide and on to the case is getting therapies. You notice that I didn't necessarily put therapies on the priority slide for kids with medical complexity, but I did put advocacy on there. And the example I wanted to share about, getting access to therapies, there's a lot more discussion now. First, families were very, very concerned. Oh my gosh, these therapies on P Day have fallen, they're just gone. My child's going to lose skill. They're going to be so far behind. And that is still a concern for families, but they're also really focused on, we just got to survive day to day, and we got to keep our family going and everybody together. And we have to live with life as it is now, reality, and making sure our kids are happy and healthy. And the other stuff is kind of icing. Not in any way saying it's not important, but it's survival mode. But a really important part of that is, therapies as a source of self-advocacy and independence and interdependence for our kids with medical complexity. And Vera in Alabama shared this really great example of her daughter, Kylie, was needing an assessment by Voc Rehab Services in Alabama for creating a vision plan. She was having trouble navigating her power chair on her own, and she needed a vision plan to help her do so. And initially, Voc Rehab was not allowing any in-person consultation and wasn't doing video. It was all over the phone. So this gentleman was trying to assess Kylie's ability to navigate her wheelchair, and Kylie's language capabilities right now are a bit diminished, so she wasn't able to fully communicate and he wasn't understanding. So everybody stepped back and was like, this isn't working. And they did some really great shared planning and a sort of emergency planning, and like, this young lady really needs this to be a kid, to be, to not lose skill, but also to advocate for herself and be independent and live her life with her siblings and, with her circle of safe friends and stuff. So they got special permission for this gentleman to come out and do the assessment. And the vision plan he did via phone versus the one he did in person was totally different. Now they have a really wonderful plan going forward. And I just thought that was such a great example of, the creative planning, emergency planning, shared planning, step back, take a breath, let's all come together and figure out how we help this kid be a kid in these really bizarre times in a really creative way. There's a problem and we're not gonna just stop with the problem. We're gonna come up with some creative solutions for everyone. Next slide, please. Okay, so summary. These are really the themes that I saw in a lot of our notes over the weeks, but then also gathered and talking with a lot of families in the last week. That people are saying, as I've sort of already said, that literally families are feeling, and this is true, this was another sort of message true, this is true for families without kids with medical complexity, with kids with medical complexity. Literally, people feel like they don't have the space and time to do everything that is needed. That is especially true for our families who have, you know, ESY now coming up, and all these therapies and skills and meetings and telehealth and everything else, plus work if they're working, plus other kids and all these demands. And how do you do it when you only have 24 hours in the day? And how do you do it if you know, are in unstable housing, if you know, don't have a job, if you're not sure about food? If you don't have enough food and you're about to lose your house, you're not going to pay attention to everything else. So how do you do all this? And that's where families are saying, we're just trying to put our oxygen mask on. And that, if I can just hop down with that to the third bullet point, the one that we've been carrying forward from Lynn Davidson's talk of being flexible, creative, and forgiving. Families talked a lot about, and it connects up to how they're feeling with reopening. They're feeling, you know, going down into shelter in place, families were feeling like, okay, you know, it was hard and heavy, but a lot of families of kids with medical complexity know how to do this. This wasn't their first rodeo of shelter in place. But the reopening is terrifying. And how you navigate that and how you navigate it as a family and for a family with, you know, kids without medical complexity, having mental health issues, families needing jobs, needing work, needing to go out. How do you navigate all of this? There's a lot of fear. And there's also a lot of judgment and isolation. There's a lot of other families in the neighborhood that are going around and doing everything. There's providers, there's professionals, there's everyone saying, well, just try this, just do this. But you can only put your oxygen mask on and take care of your family. And so the need for flexibility, creativity, and being forgiving and understanding is really heightened. And just leaning into the communication, the time that we have here to work on our shareds, the shared decision-making, the shared, you know, plan of care. How do we make some emergency plans now, you know, for the resurgence, whether it's actually happening now or in the fall, or how do we talk about, you know, reopening to school, which we'll talk about in the next echo session and stuff, but just really families saying like, this is probably the greatest test and opportunity for us. One mother said it was the greatest trial run of shared decision-making in the history of caring for kids with medical complexity. It's a real opportunity for us to ask, to listen, and to share. And that's true in healthcare, but it's also the awakening, I hope and pray, that is happening in our nation at all overall for Black Lives Matter. And I'm sure we can all see a lot of the parallels and connections, that it's time for us to really all work together and ask and listen and share and figure out, we're all struggling through this. How do we do this together?